So in this video, I'm going to be going over with you what are the different types of IV fluids that you absolutely definitely need to know. What are the difference between them? Why do we give one over the other? So that way you can better understand it when it comes to your nursing exams and your nursing tests. Go ahead and stay tuned and watch this video, and we're going to get right into it. Alright, so let's get right into it. Let's talk about different IV fluid types. What are the different types of IV fluids? We're not going to go over every single one, but we're going to go over one of the ones that's most important for you to know that you're most likely going to be seeing. So the first one is going to be your normal saline, right? Now, depending on the manufacturing or the type of medications or fluids that your hospital gets, it's not all going to look the same. In fact, this one that we're looking at right here, this is a 500 ml bag versus a 1 liter or 1,000 mLs, which is what you typically will be giving. So normal saline, we usually give it to patients that are usually there with dehydration, right? So patients that are typically dehydrated, patients that are not eating, they're not drinking, they're vomiting, they're nauseous, they're having a lot of diarrhea. These are the reasons why you're going to give the normal saline. So the normal saline is going to pretty much help to maintain their blood pressure, so that way it doesn't begin to drop too low. And then that's essentially why we're giving them fluids. Usually the goal when they're on the fluids, it's not long-term, it's a short-term solution. All right, so until the patient can begin to hopefully eat and drink on their own. If they can't, then eventually they're going to look at a longer-term solution such as like TPN. Right, which is parenteral nutrition. All right, so with normal saline, it is what you call an isotonic solution, right? So that means there's a net movement of electrolytes in and out of the cell, and so this is typically one of the ideal solutions that we're going to give. The other one that you also may see as well is lactated ringers. So lactated ringer solution looks like this. This is the bag, and lactated ringers, we usually give it to patients post-op. So it's one of the number one saline solutions that you're usually going to give after the patient comes back from surgery. So you have to remember that sometimes even before, because when they are going to surgery, they're NPO, right? Nothing by mouth. So we still need to be giving them some fluids in order to maintain their blood pressure, right? So they don't bottom out during the surgery. So with lactated ringers, it's the ideal choice before and after surgery for the patients. It's once again what we call an isotonic solution. Once again, there's a net movement between the number of ions or electrolytes going in the cells as there is going out of the cell. So it's the isotonic solution, and it's ideal. It's usually going to help to sustain their blood pressure, so like a maintenance solution. So it's pretty ideal without it resulting in the patient's blood pressure becoming extremely high, right? So usually lactated ringers is what you'll see the patient will be on before and after surgery. Once they come back from the surgery, then eventually the doctor will likely discontinue this and start the patient on a clear liquid diet, because now the patient's able to eat and drink once their bowels have returned. So once you hear active bowel sounds, then the patient can start to be on a clear liquid diet, and then there's no need to keep them running the fluids, right? So remember when it comes to nursing, pay attention to if your patient is on fluids, why are they on fluids? Do they still need to be on the fluids, right? Because if they are on fluids and they're still eating, drinking, or if they're getting a high amount of fluids per hour and they are like elderly or something, then you're going to put the patient at risk for fluid overload now, right? So pay attention to why the patient is on fluids, especially if they had surgery like a couple of days ago and they're already eating. Another one is going to be dextrose saline solution, D5. So when it comes to dextrose, we don't give it all the time, and sometimes it's given to patients that have more like they're not eating, they're not drinking, and many times it's the solution that we give between TPN or until they have like a permanent G tube or something. So a lot of times what happens is that, let's say we establish, okay, the patient, they are not eating and drinking, right? So initially we start them on regular fluids, but now they haven't been eating for days. They haven't been drinking for days, right? They're still vomiting. So temporarily they may put them on like a D5 solution, so that way their body's still getting glucose until the doctor's ready to start them on like TPN, or if, for example, it really depends on why they're not eating or drinking, right? It could be they may have a bowel obstruction. They just may have some type of issue going on with their GI system, and so they're going to need a PEG tube placement, right? Which is where they put a PEG tube in, and so then that will look like them having a permanent tube in their belly, and then as a result, they're going to get like feeding around the clock, and then they won't be on this anymore. So dextrose is not usually the solution that we put patients on long term. It's usually like an intermediate until they're on something that's going to be long term. But it helps to give the patient glucose. We may also put patients on this too if maybe they're eating a little bit, but for whatever reason their sugar is consistently low. Like they're not able to keep their blood sugars high, and so this may be a short-term solution until we figure out what's going on with the patient. Right, so D5 is not always a long-term solution. Another reason why too is that when you give dextrose long-term, they're going to develop hyperglycemia, right? They have a higher chance of developing hyperglycemia, and so then now you have to constantly give them insulin even if they're not diabetic, right? So this is the thing with D5. It's usually something that's not a long-term solution, right? But it will help with patients that are not, for whatever reason, able to retain food, eat, drink, etc. Then the last one that I want to share with you is hypertonic saline, 3% normal saline, 3% sodium chloride. So this right here, this can be very dangerous to give if you're giving it to the wrong patient. So this is where you're giving a very high amount of sodium. All right, very high. I honestly, in all my years of nursing, I've never given this. I've had to give it because this is when you usually give it to patients that have severe hyponatremia. So this is going to be your patients that have very low sodium for whatever reason, and because the sodium is so low, it's resulting now in the patient developing neurological problems such as seizures, such as confusion, etc. So we're going to give them this to help begin to bring that sodium levels up so that way they don't go into this issue. And this could be like patients if like I mentioned in another video, if their sodium is like 116 and low, like really low levels. And of course, this is not the long-term solution. And you can see even in this photo here, this is a 250 ml bag. It's not even a 1 liter bag that I'm showing you right now, because you have to be careful when it comes to giving this much salt. We have to make sure the patient really is hyponatremic. All right, so that's essentially the different types of IV fluid bags. Comment below what you learned from this video, which ones that you've given before, which ones you've seen, which ones you haven't seen. I would love to hear from you in the comments. And once again, if you want to check out our website, choosenursing.net, for some of our resources or to download our freebie, go and check out below to download our RN Success Roadmap or How to Become a Nurse Roadmap. And that's going to teach you exactly what you need to know to become a registered nurse. And then hit the subscribe button if you're not already subscribing. And we'll see you the next time.